Hello, this is Dr. Gay from First Lake MRI, and this is a 30-year-old male who injured their chest bench pressing. They suspected a pectoralis tear, and they have a pectoralis tear for sure. Often these are really hard to tell if they have a tear or not, and this is just opposite. It's a very simple, straightforward case, so I want to show this because it shows the basic anatomy, and it's just easy compared to the other examples that are not very instructive because they're so difficult to tell what's going on. But in this case, we can see we have a coronal view. We see this bone up here in this top called the clavicle. The sternum is right here. This is the sternoclavicular joint, and this bone comes here obliquely or horizontally rather. Here's the humerus, and the pectoralis has two components. It has a superior component called the clavicular head. Here's the clavicle, and this is the muscle belly, and the muscle belly comes down here obliquely right to here, and then it attaches on the humerus down here. And so the attachment is usually not well seen, but the muscle belly comes down all the way. You can see muscle, muscle, muscle. There's no short tendon or anything. It looks like the muscle comes right down and then attaches to bone with just a very short tendon slip. Now the other component, which is larger, is called the sternal head. So this is the sternum right here. You can see these costochondral cartilages here in the front, cartilaginous portions of the ribs. These are the bony portions of the ribs right here, here, here. And this is where it's cartilage, bone. That's why it looks different. And here's the sternum. So we have another component which starts up here and comes all the way down. This is called the sternal head of the pectoralis. And this is the tear. You can see a well-defined tear like paper. It ripped and tore backwards. The muscle belly is contracted. Here's edema or hemorrhage. This is a component down below that's not oriented properly. This should come sideways over here. Instead it's lax. So this is just shredded and torn back. The only thing left is a little strand along the top. And it looks like it may even be partially torn. It has edema in it, or it's bright instead of dark like it should be. So this is a near complete tear of the sternal head of the pectoralis. You can see it right here on this axial view. Here's the front, outside, medial. Here's the back. We can see this obvious, well-defined tear involving the distal muscle fibers of the pectoralis, and you can see the hemorrhage and this fluid-filled gap here. If we go up high, you can see how hard it is to tell where we are. This is the sternal head, but it's just difficult to tell in this image. And the other tears, sometimes the pectoralis tears can be here at within the distal muscle. It can shred like this. Often they're right at the junction between the muscle and tendon, where the muscle looks almost normal, and it'll tear at the tendon. Sometimes it'll tear over here where the tendon slip attaches to the humerus here. And sometimes it'll just tear right here, and it'll drift backwards a little bit. And this is such a small tendon slip, it's very difficult to see. It's a linear band, and so sometimes it'll be torn from there and it'll retract back and be very hard to see. The muscle will look pretty much normal or close to normal, and it can be very difficult. But this is just a nice, easy case of a near complete tear of the pectoralis sternal head and then an intact clavicular head. Thank you very much.